Now, the Eastern Cape government is stepping up its vaccine rollout with pop-up sites at shopping centres.
Well, the province has less than 4,000 active cases and almost 300 hospital admissions. eNCA's Nceba Ntlanganiso visited one of the sites where he caught up with the province's Deputy Health DG. Have a listen.
Eastern Cape government is hard at work trying to curb the increase of the COVID infections in the province. As we speak right now, health officials, they've come to the shopping center right here in Danzane Highway, where they can target the place where they can find people in numbers in order to encourage them to come and vaccinate in numbers. As the country, some parts of the country are already experiencing the fourth wave. Well, right now we've got Dr. Lita Matuane, the DDG of the Department of Health, who's going to talk us through how the department is doing in order to curb this increase of coronavirus. Dr. Matuane, thank you so much for joining us here at eNCA. Where are we sitting in terms of the vaccination as we speak right here in the province?
We at the Eastern Cape are really hard at work trying to ensure that we vaccinate our people as much as possible. As it is now, we have already vaccinated we have already given 3 million doses of vaccination. That translates to 2 million people having been vaccinated already. And that also means 1.8 million have now received a full vaccination coverage. So now we are busy trying to make sure that we are continuing with our vaccination program. We are now moving really steeply into the fourth wave. We have seen over yesterday that the province has seen 1,000 new cases that have come through, okay? And if you look at that, that is an increase of about 300% from last week, because last week we had 1,000 active cases. We now have 4,000 active cases as we sit now as a province, and that means the numbers are going up. And we have seen that those numbers are mostly with the youth and the data are getting positive. So far, we are holding on, hoping that things are a little bit controlled, because when you look at the hospitals, the numbers in the hospitals are not as high. We have 298 people that are in admission, and most of those 267 are actually people that are in the general wards. And the pressure on the ICUs and the high cares is very low.
Some coming home, coming from places of work. How are you going to make sure that you control and make sure that we don't get the virus spreads throughout, as we are sitting already almost 4,000? How are you going to do to make sure that you control this?
Yes, everybody is out and assisting us. The Department of the SAPS and the security cluster are assisting us in ensuring that in the places where we're saying we need our people not to aggregate in huge numbers, they are out there trying to assist, controlling the issues around alcohol, because we know that alcohol is one of the areas where people become excited and then they do not comply with the non-pharmaceutical protective activities. So we're out there trying to do that. On our side as health, we're busy ensuring that we go out, we do the tracing, we do the testing of those who are positive, and ensure that we encourage them and train them around isolation and around quarantine.
Well, yesterday we were with the Gift of the Givers, where they mentioned that they've been called by the health department as well as Eastern Cape government actually to come and assist, as the Department of Health is failing to provide food in the hospitals. Is that the case?
We do have food. We are working with our partners to ensure that they deliver timeously on food and other consumables. But the issue that the Gift of the Givers have been very good on is the issues of trying to ensure that they assist us where they can. But we have seen that they've come now with this issue that they say they can assist with food where facilities are a shortage of food, which we do not have. But as you know, that on the facility side, the CEOs would be excited to say, oh, we're having this thing. We can't look a gift horse in the mouth, and we'll accept what people are bringing to us, which is fine. We are not saying that they must not accept it, but we want to put it on record. The department, the province does not have a shortage of food, and we have not called on anybody to come and give us food.
Well, that was Dr. Matuane from the Department of Health telling us that the numbers really are increasing in the province. As we speak, the province is sitting at about about 4,000 active cases. And now it is a worrying factor. As people are coming on holidays, coming during the festive season, coming from places as far as Gauteng, Western Cape, where the numbers are sky high. But they're saying that they are ready, as the health department or as the government in the province, making sure, working together jointly with all other departments to make sure that they control and make sure that things don't go out of control during this pandemic. Well, on the issue of the scarcity of food in the hospitals, he denies that, as we have seen, what the gift of the givers or heard, what the gift of the givers was saying to us. Nceba Ntlanganiso, East London.